Hello and welcome to the Raw Fork podcast. I'm your host, Dr. Marina Buksov, and I'm a functional medicine pharmacist in New York, as well as an integrative health coach and clinical herbalist. I'm pleased to go into season 3 of this podcast and continue to bring on other holistic minded pharmacists, as well as healthcare professionals to the show. I'm constantly inspired by my guests and their stories and love sharing their points of view with you all. Hi, and welcome to another episode of the Raw Fork podcast. I have with me today Dr. Amy Sapola. I should have asked you, how do you pronounce that? Sapola or Sapola?
Sapola, you got it.
Awesome. So she is a certified wellness coach and a functional and integrative pharmacist. So without further ado, welcome to the show.
Thank you. Thank you so much for having me. It's a pleasure to talk with you.
Likewise. Well, the pleasure is mine. So I'm glad you were able to make a virtual appearance in different time zones across the U.S. So why don't you, in your own words, give us just a brief introduction about where you grew up and how you came to be a pharmacist?
Yeah, sure. So I grew up in Canton, Ohio. That's still where most of my family lives. When I was about 13, I moved to Irvine, California. And I think that probably had the biggest impact on who I am today. It definitely opened my eyes to a lot of things and kind of a healthy way of living and farmers markets and really getting into just, living like a healthy life. And so I lived in Irvine through middle school, and then we moved back to Ohio for my high school. And then I went to Ohio State after that. But while I was in high school, my dad actually helped me get a job with a local pharmacist who was the wife of someone he worked with, and said, I think this might be a career you should consider. And at the time, I wasn't sure what I wanted to do, but I took him up on it, and this pharmacist was just amazing. Everybody knew her, and she knew everybody by name, and she was just I don't know, just amazing. And so I just really took so much inspiration from working with her that I decided that in the long run, I wanted to be a pharmacist. I knew kind of at that time, though, I was really much more interested in nutrition. So I first did my undergraduate in nutrition and then went on to pharmacy school.
Oh, wow. So different right off the bat.
Yeah. Yep.
So it was a total of 8 years then.
Mm-hmm. Yeah, it was.
So having that background of nutrition and the healthy lifestyle from California, how did that impact you throughout pharmacy school?
Yeah. So I think I've always been different. So I started doing yoga when I was 15. And I think that really just gave me a different outlook as well. And in pharmacy school, I think I was just open. I was open to learning everything. I understood why I was there. But I also understood that I wanted to approach things differently. And with the education in nutrition, I really felt that was kind of fundamental to a lot of chronic illness or disease, that there was some sort of nutritional imbalance there. So it just gave me a different lens to look at things. I also just really enjoyed all our supplement classes and, the electives that you could take. I love that part. So yeah.
Yeah, it's nice to hear you say that because I also hear that a lot of schools don't offer electives of that nature. So that's really cool that you were able to take them. I also personally had an alternative and complementary medicine elective that I loved. But yeah, I hear that nutraceuticals and supplements aren't really taught in most schools.
I know. And that's luckily I did. I had a really good class on that. And even now I precept a lot of students, and I have a functional and integrative rotation that I do for APP students. And I worked with the University of Minnesota, so I'm actually coming out with a functional and integrative elective course for pharmacy students. Hopefully, with COVID, it's been pushed back a little bit, but hopefully in the next couple of semesters. So yeah, I hope things are changing for students and that, they can learn more, because when it comes to over-the-counter supplements, I feel like people coming into a community pharmacy do expect you to be an expert because you're selling it there. And really, we don't necessarily have a ton of education around those things.
Yeah, I remember we also had an elective of over the counters slash self-care. So that's, yeah, another way of looking at that. And
Yeah.
certainly, if you are selling it and providing it in your store, you should be able to counsel on those things and find companies that you trust that are good quality, so that are well tested or third party tested.
Absolutely. And there's such a wide range of products out there. And that's one of the areas I'm really passionate about and I work with students on is all too often, I feel like if people don't know a lot about it, they just assume there's nothing else to know about it. Or like for students, especially, they'll be like, oh, they're all the same. Or, like, oh, I just stay away from all natural products because like a big misnomer or misconception would be that they're not FDA approved. So they're not safe. So don't use any of them. And I try to really have students look at the research and, what is out there. We use a lot of different webs like databases like Consumer Labs and the National Medicines database to really look at what information is out there and take a much more educated approach than just kind of a generalization of all things in that category.
Yeah, those are the top two that I'm familiar with also. And I hear all too often that people just don't want to dabble in it, like you said, because we just don't know enough. So it's better to stay away than kind of dig deeper and learn more.
Mm-hmm. Absolutely.
So out of pharmacy school, after graduating, what were your next steps?
Yeah. So I went to work at a large hospital and was an outpatient pharmacist there, and then was promoted into specialty pharmacy. So I was a specialty pharmacist, and I specialized in when the new hepatitis C drugs were coming out. So really in hepatitis C. And then I backed up like oral oncology and transplant and those sorts of things related to specialty. And then after that, I left there and I went to be the manager of outpatient pharmacy services for a different health system where I opened, we had one outpatient pharmacy and I opened a second one and started the ambulatory care services. And then I left there to be a clinical pharmacist where I am now as well. Where I work inpatient and outpatient and do MTM and all the things. And we also do a lot with supplements. We have an integrative physician on staff. So we did our fellowship together, and it's just really nice to have someone to work with like that. So, but that was sort of skipping way ahead. So right after that, I did my 200-hour yoga teacher training soon after that and got certified as a wellness coach because I did see I was doing a lot of counseling in my first job. And actually I was in a pharmacy that had no drugs. So we were purely counseling all day long. And like on one side, patients would drop off and you would tell them about the medication before they even got it. And then they would wait in the waiting room. And on the other side, they would pick it up. And it was tubed from like a production center. So it was sort of a weird setup. But I realized like that there could be a better way to talk with people and to kind of help counsel people. And I felt like at the time wellness coaching was the way to do that. So you learn a lot of motivational interviewing and some of those techniques like assessing readiness to change. So I did that and I loved that. And I really did feel that it was super helpful just at the time, but moving forward, it's been even more helpful. And then I did my 200-hour yoga teacher training. I did an Ayurvedic yoga specialist training, so I got into Ayurveda. And then I became a Reiki master. And then I did the Academy for Integrative Health and Medicine 2-year fellowship after that, which really was just wonderful and kind of brought together all of the miscellaneous things I had been doing into a more structured training. And then during that time, I found functional medicine. So like a crazy person, I did them kind of concurrently with a 6-month-old baby. So so I did functional medicine through IFM. I did all of their like the advanced practice modules. And then I sat and did the IFMCP exam. So I think they said I was the 17th pharmacist in the world to get certified through them in functional medicine, which was exciting. So and that pretty much takes me to present.
Wow, that is pretty amazing. I mean, I'm sure a lot
Thank
more
you.
pharmacists have followed in your steps since then, but
Yeah.
you're a pioneer.
Thank you.
So, okay, so all of this was happening, like the alternative and integrative and functional world was happening concurrently to you being a full-time pharmacist, as I gather, and
Yeah.
other practice settings.
Yeah.
You're having a family and babies and all of that stuff. So that must have been super difficult to juggle.
Yeah, I mean, it definitely hasn't been easy, but I think I, like probably a lot of your guests, really have like that drive to learn. And so for me, I just love like continuing to learn and to teach. And so it's kind of different when you're learning things that you love, and that you just like deeply enjoy. And I feel like it's really had such an impact on my own life. So it's really been worth it. And I think it's hard, but I always tell myself like it'll probably never get easier, like so
Comforting.
yeah. So, but now I am taking a little time. My husband always teases me like, what's your next training you're going to sign up for? And now I am actually taking some time to just kind of absorb it all. I feel like a lot of times we set this bar and we're like, okay, now I achieved it. And you like live in that moment for like a day and celebrate it. And then you're
Yeah.
already like on to the next thing. So I kind of just want to celebrate where I am. I'm also working on my own business. So I'm doing consulting and functional and integrative wellness coaching. So I'm just kind of focusing on that and my podcast. So I host the Nourish and Shine podcast. So yeah.
Wow, that is pretty amazing stuff. So
Thank
the
you.
the fellowship that you mentioned earlier, that was of the integrative nature. It wasn't like a traditional residency plus fellowship of a pharmacist, right?
Right. Yeah. So it's through the Academy of Integrative Health and Medicine. And it was the first of its kind in that it is a 2-year fellowship, and it's interdisciplinary. So it was myself and one other pharmacist in our cohort. We were the second cohort to go through it. And it was just amazing because a lot of the education was online, but then we also flew out to Portland, Oregon a couple times a year to meet with everybody in person. So not only did you learn amazing things and get to experience a lot during those weeks in person, but we also built such great friendships. And so now, I have friends all over the world who are integrative, whatever, physicians or psychiatrists or therapists or, all sorts of things. But it was just a really neat way to meet people like me with similar interests. Because a lot of times in this community, at least to me, I can feel somewhat alone because I live rurally. There's not always a lot of people who are like in thinking similarly around me. So it's just really nice to have that group and to feel kind of at home with the people you're around.
Yeah, absolutely. Sounds wonderful. I have to check that out.
Yeah, yeah, I highly recommend it. It's a lot, so much fun, and you just learn so much.
Yeah, there's a ton of programs cropping up everywhere. So it's interesting to see like what people think about the ones they've gone through.
Yeah, University of Arizona kind of had the first integrative fellowship, and they originally didn't allow pharmacists, and then they started, but it was kind of a turnoff to me that they didn't originally. So this fellowship I liked because I love Dr. Lodog. She was the fellowship director when I started, and I just admire her and think the world of her. And pretty much anything she created, I would probably do. But she really inspired me. And I think she came from the University of Arizona and kind of saw the need to have a fellowship where more professions could be present. And I thought that was really meaningful.
Yeah, definitely. She's well known in the herbalist community as well.
Yeah, yeah. She's wonderful.
Yeah. So, okay, you've done all these things in both traditional settings and non-traditional settings, and so you also have your own business. So, how did you kind of like incorporate and build all of those things? Was it little by little, or you waited until like you had enough knowledge and skills, and then you just like exploded? How did it work for you?
I would say little by little. A lot of it's kind of like just you have to do it. One of the things I struggle with sometimes is never feeling like I know enough, which sounds kind of ridiculous when you're like, oh, I did this and this and this, but like, oh, I'm not ready. I still need 3 more different trainings, And my husband always asks me like, when are you going to use what you're learning? And so at some point I had to just get honest with myself and let go of the fear of being criticized or judged for like not knowing everything, or, not being like, I don't know, not having that extra training, and just go with it and start doing something. And I feel like that's been the best thing I could possibly do, is just jump in and get my feet wet and just start doing it. And so even with functional medicine, one of the things people don't always realize is you don't really have to have any training to say you're practicing functional medicine, which is, that's just what it is. And so I went through and did like the IFMCP, like became a certified practitioner, and still was like, ooh, I don't know, like, am I ready? And I'm like, okay, there's people who do not have any formal training. Like they've kind of learned on their own, which is totally fine, and like no judgment, but like, okay, I'm ready. Like I can do it, So I think it's believing in yourself and letting go of the fear of not being enough or not knowing enough, and really just tying into your desire and your real purpose. Because I know that I want to help people, and I want to work with women who have kind of been on a similar path to me and who are open to like functional and integrative medicine. And so when I think of that, I know that I'm ready. So I hope that answers your question.
Yeah, definitely. I mean, I see that so often that it happens to practitioners, including myself, that still keep on learning and reaching for the next thing and the new thing and an extra thing, but still not feeling like they're ready. So I can definitely relate and resonate with what you're saying and what you're speaking to. And I think it's because we want the best for our clients, so we want to make sure that we know the best approach to use, and we're aware and educated on all the modalities, so that we can pinpoint and cut the legwork and help our client immediately, rather than, in a roundabout way or just ineffective ways. So I think it comes from the passion and the care for our client. But like you said, it's like feel the fear and do it anyway, because you already know so much more than your client knows, or than the average person knows, that your knowledge can help somebody else immediately already. So it's more important to start and then learn as you go, rather than waiting until you have all the knowledge, because we will never have all the knowledge.
Exactly. Yeah. And it's also kind of that thing of being a little bit of a perfectionist. And I think a lot of pharmacists are this way, but like wanting everything lined up and like perfect before you start. And sometimes you just have to start. So, yeah.
It's like theoretical versus real life. The practice setting and real life setting just will never be a perfect world scenario. Will never fit into a perfect little neat box with a bow on top. So
yes.
you do the best you can.
Exactly.
So what were your first steps in trying to build your business?
So that's a really good question. I think really one of my first steps was just getting a website, which I don't know if that's the right first step or not, but that's where I started. I wanted to establish my presence online. So I started a website, created my presence on social media, and then just offered like a basic consultation.
So what are your current offerings on your website or in your business model? And is it online or in person? Well, I would imagine right now it's only online.
Yeah.
What do your consults typically look like or structured like?
Yeah. So right now, how I have it set up, and this is always subject to change. I'm kind of playing around with it, but right now what I have is a 90-minute consultation, and I require that before any other appointment type. So a 90-minute consultation, I use Living Matrix to do kind of like a functional medicine assessment of the client. So they get a lot of questionnaires ahead of time. And then it's nice because it pulls all that in and kind of puts it into a nice, easy to view format for me. And then, so I meet with them for 90 minutes, kind of get the basics, come up with some ideas around what they may be interested in working on, and kind of set some goals with the client. After that, I offer wellness coaching, and that would be either like a 4-week package once a week, or once a month for 6 months is how I have it structured right now, for kind of ongoing support and continuing to make that change. One thing about functional medicine is it's not about like quick fixes by any means. When you're trying to get to the root cause of what's going on, you're likely not going to do it in 90 minutes. So usually I would recommend doing an, ongoing coaching. And I use coaching as a really nice way to make like long lasting behavior change as well. I also am going to hopefully start soon group coaching, which will be nice and more accessible as far as price point goes. Plus, especially in this day and age where there is so much isolation, I think it's nice to have a group of people to learn with and grow with. So I'm excited about that. I also offer like career coaching for people interested in functional and integrative medicine. Since I have gone through a lot of different trainings, I feel like I can help people kind of avoid some of the pitfalls and know what to look for in the different programs. And then I also offer pharmacy consultations. So like for pharmacies, especially independent pharmacies in the community who are looking maybe to carry higher end supplements or get into kind of the integrative medicine space, I'll do consultations where I will come out and actually work with them. And I can do that virtually as well, but work with them on what sort of recommendations I would make regarding supplements that they would carry, and provide education to their staff. So that's where I'm at now.
Wow, really cool stuff.
Yeah.
So when you did that consult, so you mentioned you have a health coaching component to that.
Mm-hmm.
Do you also work in a capacity of a pharmacist, and as a provider for some of the visits, or is it mostly the wellness coaching?
That's a great question. So I met with a lawyer prior to doing this, and she really recommended that I work under wellness coaching and not as a pharmacist. So I certainly have that knowledge as a pharmacist, but I'm not working under my license or like in the capacity of a pharmacist. So it is somewhat helpful in that a lot of the information we're giving, especially around functional and integrative medicine, really you don't have to be a pharmacist to provide. So that's where I'm at with it right now.
Yeah, that's always like a tricky issue with us integrative and functional and
Yeah.
pharmacists, because we all have our licenses with the board of pharmacy in our state, and then each state has different laws and things that you can counsel on and you can't counsel on. And then if you're taking clients that are out of state, it also comes with its own set of little nuances. So I also find that it's better to just work in a capacity of a health coach. So, and I have that training as well.
Yeah. And at first it didn't sit as well with me because I'm like, I work so hard to be a pharmacist, but I think it really is I worked hard to be a pharmacist, and I want to protect my license as well. And I think keeping that separate, it works well for me. And again, it's what my lawyer recommended.
Yeah. And then that also sets kind of the bar for payment types, because we
Right.
usually will have to be cash based if we're health coaching, because most insurances won't count us as like a health provider.
Exactly. Yes. And that's very true. And I think you see that a lot in functional medicine. There are certain providers that certainly take insurance, but there's a lot more cash pay services. So people are, to some degree, more comfortable with it, I guess.
Yeah. And even if the insurance is accepted, a lot of the times the co-payments are through the roof, and it just ends up costing a lot out of pocket anyway.
Yeah. Yeah.
I'm hoping in the future insurances will start to pick our services up as well.
Yeah, I know. I definitely agree. And that's something I think, we definitely need to start probably tracking better. Like, they always say like tracking your outcomes and everything, but I feel like there's a lot of health coaches out there, but we aren't necessarily like in a coordinated way necessarily tracking our impacts or like seeing what sort of things we're doing, at least the independent ones. Hopefully,
Yeah. Yeah.
you know,
If
hopefully someone
we all
else.
like kind of pool our data and get some clinical evidence and numbers and outcomes out there, maybe
Yeah.
we'll start to take a look and pay attention.
Yeah, definitely.
So speaking of that, there's actually a new platform. I don't know if you heard of it, called Farm to Table.
No.
And so it's a platform to connect integrative and functional medicine pharmacists to
Oh,
clients
cool.
state and work also under that pharmacist provider status in the counseling. And then, all the legal stuff will be and, the HIPAA compliant Zoom calls and all that stuff will be handled by the company, and the pharmacist can just independently come in and get clients and offer services to people in their state.
Oh, neat. That's really cool. I'll have
Yeah.
to check that out. That's exciting.
Yeah, so I just found out about it, and I'm going to be on board with them, so I'm
Oh,
excited.
cool. I'll definitely check it out.
Yeah. All right, so you have your business set up and you work in like 3 or 4 different capacities, which is really cool. What's like your favorite part of the job?
Oh gosh. I would say it's a little bit of a story, but ever since I was young, I've always wanted to be an entrepreneur. Like I was one of those kids. I went to like Ohio Business Week and I've always loved that component. So I think really my favorite part is obviously like helping women, but also just like feeling like I'm living my purpose. And it's really fulfilling for me to actually be doing something on my own with my own business and feeling like I'm following my dreams. So that's probably my favorite.
Yeah, I hear that. And so what made you specialize in women's health in particular?
Yeah. So I think through my own health journey, personally, growing up, I had an eating disorder when I was in high school, and then I had polycystic ovarian syndrome or PCOS when I was in college, struggled with fertility, had gestational diabetes with my son. So, I've definitely had some health challenges. And because of my background and everything, I always tried to look at it in a really holistic way and try to do what I could from a lifestyle perspective. And so I felt like through my lived experience, I could really help other people. And I definitely saw the gaps as I went through the healthcare system as someone who is looking to do more and not just address like the symptom at hand, but like looking for like, what can I really do to improve my health? Like, this is a problem. Why do I have PCOS? And most people would be like, well, we don't really know. And so I really wanted more than that. And so I dug into the research and, took extra trainings and did all this stuff. And I just hope that I can be there for women like I hope or kind of wish someone could have been there for me.
Yeah, totally. I hear that too. I had my own traumatic events happen to me with over medicalization and just going through for like simple health issues and also some hormonal and PCOS related issues too myself. And the only answer was just like, oh, take the birth control pill,
Yeah.
So I was not happy with that being my only option. And then like
Right.
certain procedures that they had recommended that, retrospectively, I can definitely see that they weren't necessary. And so I just feel like we would save a lot of trauma, heartache, headache, and money, for the healthcare industry if we focus more on preventative care and like the holistic health picture.
And I mean, just the other day, I actually did a session with um, a medical intuitive, which was really interesting. And she like was looking at the emotional and spiritual and like physical components in an intuitive sense. And for me, I'm really open to all of that, and I find it so interesting. But it just brings together like the mind body component and how emotions can really manifest physically. And a lot of that just isn't considered. And there's no space to consider it in our traditional medical system. So I think having a whole approach just makes so much sense.
Yeah, I think the reason it's not considered is because it's hard to quantify it and
Mm-hmm.
measure it objectively, and so that's why it's not as researched, because it's very difficult to research it. But at the same
Right.
time, it is very important, and we do pay a lot of attention to, let's say, the issue of pain, and pain is very subjective.
Yeah.
So, these things are important, and they are affecting people on large scales, and they can cause anything from diabetes to fibromyalgia to chronic fatigue syndrome to cancer to you name it.
Mm-hmm. Yeah. And I just did a podcast yesterday with Lara Adler, who talks about toxins and like environmental toxins. And that's another piece that I think is so underappreciated and under like utilized in treatment. It's just looking at like the hormone disruptors in your environment and the chemicals that you're being exposed to just in your daily life and how that might be contributing to whatever problem. Like for me it was PCOS. But I think there's so much more to it, and of course nutrition, like that's near and dear to my heart. But in the short time now that we have to see patients face to face, I think sometimes it's difficult when you're being paid by insurance, in 15 minutes to try to address all those things. And most often it's just treating the symptom at hand or trying to appease the symptom at hand, but not really making any strides towards overall improvement in health.
Yeah, what I find really admirable about functional medicine is the movement to get to the root cause, like you mentioned
Mm-hmm.
before. And so I think we have to extrapolate that from the individual level to like a very global sense, because I see over and over again the same kind of, issues, same kind of health problems crop up, and like they really come in like these decades, like a decade of cancer, a decade of autoimmune, a decade of ADHD, a decade of like
Mm-hmm.
skin problems. So I feel like we're all suffering from this on one level or another, and it's coming out in different ways in different people. But the root causes are all very, very similar. So I think,
Right.
we have to start looking at the big picture and eliminating or preventing some of the problems that are causing this on such a large scale.
Yeah, and that just makes me think Andrea Nakayama of the Functional Medicine Alliance talks about like the non-negotiables
Mhm.
around lifestyle. And I think you're exactly right. I'm all for individualized medicine, but there are some non-negotiables that are like the basic lifestyle things that I think all people would benefit from, and could be really built into promotion of health in our healthcare system.
Yeah. And also like valued as a society. And,
Yeah.
we don't wait till the last minute to take a sick day. We just go home and rest, because otherwise we'll be out of commission for 2 weeks.
Yeah.
We really get sick.
Right, exactly. And just, thinking about like the availability of organic produce and, like subsidizing those sorts of things
Yeah.
versus corn and soy. So
Yeah,
just kind of putting our money where we can make the biggest impact.
exactly. And like the people that have the money to invest, please look out for these causes and
Yeah.
get educated and try to contribute, because really we're all suffering on one level or another, and if not us, then the future generation will be even worse off. And
Mhm.
climate change and all of that also plays a role, because the way we grow our food is directly contributing to both the health problems that we're all facing and the climate problems, so the whole earth is facing those.
Yeah.
So
And it's interesting raising children right now. I have a son who's almost 2 and a daughter who's 4. And like we talk about a lot of those things in like a way that children will kind of understand, but just like being kind to the earth and trying to grow vegetables and those sorts of things. And I think it's really neat to see in their eyes how they can get excited about it and just, hopefully to be raising the next generation who will understand and care and want to make a difference around these things. And I know there's plenty of people in our generation as well, but just to continue that, that hopeful, force of change.
Yeah, planting the seeds. And
Mm-hmm. Yep, we have our environmental flashcards. They come out with me, and we do like for Earth Day, we went out on the beach across from our house and picked up trash, and we try to do what we can, and I try to help them just be aware of things, even from a really young age. I feel like kids are so smart, so.
absolutely. And I think that is also a problem. Like the fact that people are ignorant, it's not really their fault. It's just that that's the way we are as a society on the whole. And we don't get that education. If our parents or our communities didn't
Mm-hmm.
provide that, our schools certainly don't provide that.
Right.
And like when we get trained to be healthcare professionals, we don't really get provided that. So it really does start on the individual level, and starting with planting the seeds in our children and whoever's right around us in our little circle of friends and family, but then trying to have that ripple effect and educating as many people as will listen to us.
Yeah, absolutely. Yes.
Yeah. So what's next in terms of your business and your pharmacy career? What's on the agenda?
Yeah. So, I think my big next step is probably continue with the coaching and consulting and hopefully growing that business. Also, though, really moving into groups. I'm excited about working with people in groups. I'd also like to do some more online curriculum, to be able to offer like online courses. And
Mhm.
then, like, my big dream, which I would just love and hopefully will happen, is I would love to read a book, but that's a
Yeah,
little further out.
those sound really well. So what about that program that you're offering to students of the APPEs for pharmacy students? Can you talk a little bit more about that?
Yeah, so it's still in the development stages, but some of the students at the U of M were amazing and so supportive, and they helped work with kind of their administration to advocate for creating a functional and integrative elective for pharmacy students. So they said okay to it. So now I'm working with their curriculum developers to come up with a semester-long course. I'm not even sure at this point, when it will be ready, but we'll have a semester-long course in functional and integrative medicine, which will hopefully give students a really good broad overview, but also give them the lens, just a different lens to look through and a different kind of toolkit to use. And that's how I look at my training so far. It's you have more tools in your toolkit.
Yeah, I see it the same way. So, will the students have a chance to shadow you in person and kind of like follow what you do in your business or in your pharmacy practice? And or because of the whole virtual necessity out of COVID, do you envision it also turning into more like a virtual program?
Yeah, so it's planning to be all online right now with everything going on. I do take APP fourth year students, so in person for 5-week rotations or 6, depending on the university. But and I'm still doing that. I have a student coming on next week, I think. So it's different now. So one of the things I love about my rotation and is and I hope the students love it. I know some don't, some do, but I really get them involved in our local community and food issues. So we have my husband and I and a bunch of volunteers helped create gardens at the hospital. So we grow, like we have a vegetable and herb garden at the hospital. So I have our students actually go out every week and help harvest. And so we use those vegetables and herbs for our residents, for our staff, like in our cafe. So yeah, and for our hospitalized patients. But so I get them involved in that. We also have a community garden where I started working with the person who runs the community garden, that at that site, all the produce that's grown is basically donated to the food shelf. So our students will go out with me once a week to the garden, and we help harvest, and then we bring it back and they help clean it, and then they go down. We have a food shelf on site at our hospital. They actually go down and help people on the days the food shelf is open, help people to select some of the vegetables that they've harvested that week, and also to kind of talk about ways that people can use them. So they can see some of the social determinants of health. They get experience. A lot of, I'm like shocked by how many students have never gardened or like done anything related to growing plants. So they get to experience that firsthand and get a little dirty. And they get to try a lot of the fresh produce themselves, because I always, as I'm walking around with them, I'm having them taste things and, just really, really get into it. So it's a unique aspect. They also get to spend time with our integrative medicine physician, and shadow her on her visits. So they get to see a lot of it firsthand, and then with me in like MTM consults. So
Wow.
it's a fun rotation.
I love those initiatives.
Yeah. Plus we read and do a book discussion on Dr. Lodog's book, the Fortify Your Life book, which is so good on supplements. And so we do really deep dives every week into supplements.
Wow, really cool. Well, I hope you do get to expand these kind of educational opportunities to a more, diverse audience, that maybe like different states, you can like partner with pharmacy schools in different states. And them. I would really love to, to see these kind of rotations thrive and be open to more people.
Yeah, me too. I hope so as well. I think that would be wonderful. And I love working with the students. They teach me so much. I think they teach me just as much as I teach them, if not more. So it's really fun.
That's that symbiosis happening.
Yeah, that's right.
Yeah, or you could also teach other pharmacy schools how to offer electives like this. I would have loved an elective like this.
Yeah, totally. That would be amazing.
Yeah. But yeah, you bring up a good point. Like I myself have never been around plants or herbs until I started studying clinical herbalism from like a medical lens. But really, all of us as children, we do have like this connection to the earth and the plants, and we know intuitively that we need to walk our kids outside every day as babies for them to get fresh air, and like to have them play in the little, yard outside. But then when we grow up, we kind of like lose that connection with playing with the dirt and like being happy out in nature. And, living in a city, I've lived my whole life in a city. I've never grown my own plants, not even like on a balcony. I barely ever had a balcony.
Yeah.
So it's really nice to, if you have the means and the space, and if you don't have the space to grow anything, to just go out into like hiking, nature, scenic places and things like that.
Yeah, absolutely. And I think one of the statistics I recently posted on my Instagram was that I think it's like 4 hours a week is the average that people are spending outside now. And the rest of the time is inside or in cars. And I mean, 4 hours total is like not very long. So I think, spending that time outside, I just took a course. I just finished my master gardener training. So I just took a course to do that. That's called something to the effect of Nature Heals. And it was all about just like the healing power of nature. And the clinical study is actually on the healing power of nature. And I was just blown away by what an impact you can have in your own health by literally just taking time to get outside. Not to mention like getting vitamin D and fresh air and sunshine and all those wonderful things. But it really is so calming. And just helps blood pressure and depression and, all those things. So
yeah, it kind of resets us into that rest and digest state.
Yeah.
And the relaxation response can really be profound in all of our organ systems. And so the science is there, and also the intuition is there too, that like it makes us feel good being out in nature. And actually the podcast interview I just had before you, we talked all about that with this company, Biophilia Wellness.
Oh, cool.
It's another pharmacist who promotes, like spending time out in nature, and she's a nature therapy guide.
Oh, neat. I just posted about biophilia this last week. That's really funny.
So she
Very cool.
Biophilia, and so check out that episode as well.
Yeah. Oh, cool.
And also, if you don't have access to growing your own food, you could always find a community garden. Some of them specialize in medicinal herbs. So if you're interested in that, or just growing veggies, just like getting out there and meeting also like-minded people that are interested in these kind of things. And like you said, just tasting the freshness of a locally
Mhm.
grown organic produce, and also like watching the cycle of it, from seed to fruit, is really amazing.
Yeah, and even container gardening has come so far. If you even do have a small patio or a windowsill, you can start really growing even just a small little container can make a big difference.
Yeah, I see like commercials for these tomato sacks. So
Yeah.
there's a way.
Yeah, that's right. I think people are getting so clever with ways to grow things now.
Yeah, I've
So it's
started
really fun.
to utilize the, growing things from scraps technique from like lettuce heads and like
Yeah,
celery stalks and things like that.
that's awesome. Yes, we just have, I mean, we're right in town. And so we have a relatively small lot, but we grow so much stuff on just like a small in-town lot. And we have like two pear trees, two apple trees, a cherry tree, two hazelnuts, two elderberry bushes, like strawberries. We have three blueberry bushes. We grow hops. We're all
Nice.
over the place. We have rhubarb, we have raspberries, but our landscape is really like an edible landscape throughout our yard. So I have like a section of the yard that's medicinal herbs. But generally I mix in throughout the yard a lot of different edibles and like different herbs and everything. And we just have a lot of different raised beds and stuff. And that too has been an evolution. Like we didn't do that all in one day. And thank goodness my husband's a landscape architect. So he can like totally
Wow.
feed my crazy gardening obsession because I can dream it and he can make it happen. So it works out really nice.
What a great pair.
Yeah. Yeah.
Wow. Well, I really want to visit your garden now.
Yeah, come anytime. You're always welcome.
As soon as possible, I'll take you up on it.
Yes, I know. We could visit virtually even if you
Yeah,
want.
right. I'll imagine tasting the beautiful blueberry.
That's right.
All right. Well, I want to thank you so much for spending this short while with me and sharing your wisdom and your amazing journey with us. And so, if you just have a couple more minutes, I have a few rapid fire questions for
Oh,
us.
sure. Yeah.
Okay. What's your number one advice that people can start doing right now to improve their quality of life?
Ooh. The first thing that came to my mind was mindset. Um, I love Gabby Bernstein, and the one thing she talks about is the choose again method. And so, if you're having like negative thoughts or whatever, like you can consciously choose again. So that would be it. Mindset.
Yeah, so important. Okay, number two, what is your favorite hobby or pastime?
Gardening. That's an easy one.
Nice. I mean, you seem to have a variety of interests, so
Yeah, yeah. I mean, we live on the river, so I love to paddleboard and water ski. I grew up water skiing. I love swimming it upriver and back down, and I love yoga a lot and meditation, and I walk every morning. Those sorts of things. But I really love gardening and cooking.
awesome, awesome. Okay, number three, what is your favorite beverage to drink?
Ooh. So like this depends on the season and kind of the day and my mood. But today my answer is probably matcha.
Mm,
Um, I have been on a matcha kick. We went on this 3 week cross country little vacation recently where we drove with our kids who are 2 and 4, and people thought we were kind of crazy, but we drove like from Wisconsin to Texas to California and kind of back. And on that vacation, I got really into matcha. So anyway, I've
maybe
been drinking that.
of traveling with two kids.
Yeah, yeah, seriously.
Keep your energy.
Yeah, I know. It's nice. I don't drink coffee with caffeine, so I drink decaf ever since I've actually even before when I was trying to get pregnant, I actually got off of caffeinated coffee, and so matcha is kind of my first foray back into like caffeinated things, but I really like it.
Yeah, I mean, I never really drank coffee every day, but definitely I stopped like through pregnancy and breastfeeding. So now
Yeah.
I have some like I just get jittery, and if
Yes.
not right away, then like after an hour or so, I'll get jittery.
Yeah.
It really tells me like, okay, maybe maybe I'll stop the coffee for now.
Yeah. Yeah. And I drank Rasa coffee for a little bit, which is like a coffee substitute. I don't know if you're familiar. It's like an
Yeah,
herbal substitute for coffee, but
so it's probably similar.
yeah, yeah. And some of the substitutes are great, but sometimes, I don't know, a cup of coffee, you just can't beat it. So I do occasionally still have decaf, but
Yeah. I love the taste of coffee. Just like
I
I
do
never
too.
I was never one to drink it every day, but after like a nice rich meal, I like just
Yes.
a bit of coffee or cappuccino.
Yeah, I totally agree.
All right. So lastly, please tell the listeners how they can learn more about your work and get in touch with you.
All right. So you can find me on Instagram at Amy Sapola. You can find me online. My website is www.amysapola.com. I think on Facebook I'm A Sapola Farm D. Should have looked at that ahead of time, but just search me and you'll find me, hopefully. um, and I'm on LinkedIn. So you can find me any of those ways. I'd love to hear from you. If you have questions or any comments, please make sure to send me a message.
Yeah, so we'll include all those links in the show notes, and so everybody can just easily access any of those links.
Awesome. Thank you.
All right. Well, I had a blast. Thank you so much for coming on, and I hope to keep in touch.
Yes, thank you so much. This was wonderful. And thank you for all the work you do.
Thank you. I appreciate it. All right. Have a good evening.
You too.
Thanks for tuning in to another episode of the Raw Fork podcast, and I truly hope that you enjoyed it and learned something from it. If you did enjoy it, please don't hesitate to leave us a 5-star rating and a short, sweet review so that other listeners can find us across podcast platforms. To get in touch with me, you can go to rawfork.com or email me directly at marina@rawfork.com. Thank you, and I hope to see you back here next week.